My name is Richard. I'm a massage therapist. I'm going to demonstrate today a full body massage, but accelerated. It won't take traditional 50 minutes. It will take a shorter period of time. And so we're going to start with a classical Swedish massage, client in the supine position, starting from the head, left arm, left leg, right arm, turn them over, right leg, torso. Okay? So, just relax. First thing I'm going to do is some gentle traction on the neck. There are many ways to start. Remember, when you pull up on the neck, mid-cervical region, the chin will come up towards you and your hands will not slide off because the occiput will stop your hands. I'm going to work some of the facial muscles. Frontalis. Buccinator masseter, just some petrissage. It's very good because a lot of stress is held in the face. We want to always work the facial muscles. And pull some of the muscles up. Orbicularis oris, mentalis, and a little bit under the chin, the platysma. Just stretch out the frontalis, stretch it out. And the ears, you can do a little ear reflexology. I'm not working any specific points. I'm just pulling on the ears gently. Very good for fascial restrictions in this area. And I'm going to do some points over the eyebrow. Since this is not a shiatsu session, I'm not paying special attention to where the points are. Supraorbital. And then a few infraorbital points, and I follow the zygoma. Some pressure points. Stabilizing with my other fingers. Working my way up to the TMJ. And some gentle friction, circular. Maybe one final traction on the neck. Now, another stroke that I like very much. Hands up, fingers up, no, relax. I'll do all the work. And now, I'm doing some gentle friction, mid-cervical region. Just moving my fingers back and forth. Notice the entire body is moving. So a lot of specialized work can be done up in this area, depending upon the client's needs. You could turn the head to one side, you could work muscles this way. I like to push down the shoulders to remind them to be down there. You can do the same thing on the other side. Don't help me. I always have to tell my clients not to help me because they like to be helpful, but to try to learn to relax and breathe. And I bring the head back into a neutral position. Some points, base or root of the neck. Lean in the supraspinatus fossa. So you're getting the supraspinatus and perhaps part of the superior trapezius. Out to the acromioclavicular junction, do a little friction, because that's an attachment site for the trapezius. And then I'm going to go on now and follow the circulatory flow of blood, the pathway of blood, of the left ventricle. Okay, so I'm going to reach under. I'm going to get her hand. Bring her hand down, sweep under the fingers. Try to relax. Okay. And I'm going to lubricate the arm. I forgot to tell you that when you work on the face, if you do any work on the eyes at all, make sure your client is not wearing contact lenses. It's very important. And I bring my lubrication down, lubricate the entire extremity here, and then stabilizing the hand, watching my stance so that I'm using the proper biomechanics, leaning in, some effleurage of the entire limb up over the deltoid, nerve stroke back. Leaning in. Some nerve strokes, okay? And now I'm going to lubricate. I don't use a holster, so sometimes I just have to jockey my lubricant around. I'm using cream. Do not like oil, it's too oily. So I'm going to use my arm as entrapping. This is one way of working the upper extremity. This is how I was taught in school. Okay? So I have two hands free now. So I can work her deltoid. Notice I'm supporting the elbow with my other. It's very important to open up this medial lymphatic chain. This is the gate that allows the lymphatic fluid to go from distal to proximal. Okay, and I can do some ringing, or chucking. Some people have different names for it. Okay. And not too quickly so the fluid has a chance to flow. And then I'm going to take her hand, her arm, sweep under the fingers, relax, relax. So that the fingers don't curl up. Do another effleurage or two. And now, like this, the forearm, the flexors, switching hands, notice, stabilize the joint. And now the hand. There are different ways to work the hand. One way is like this, just pick some points, press in. You're not doing a specific hand reflexology session or treatment. Do the dorsum. I like to work each finger by milking. It's a pill rolling type of motion. If your client offers you a finger, tell them to relax, not to do anything. You'll do all the work. Another way of doing the palmar surface of the hand is a pinky here and a pinky here. Relax, relax, relax. Some points, some points, some points, some points. And I put her hand back down, sweeping under the fingers so they're not curled up. One or two more effleurages and a nerve stroke. That's done. Okay? Now I take her arm and I put it back under here. Okay? Try not to expose your client while you're doing that. Sometimes it happens, and just keep going. You know, our draping is important, but we're not perfect at it. Now, here, to do the left leg, I'm going to use this kind of a triangle. Okay? So, and then I just fold over on that triangle, fold over, and tuck and tuck. Okay? If her hand's in the way, you could always move it off to one side. And now if you find the leg is everted, the foot is everted, externally rotated, you can rotate it back in by just a little bit of rocking, loosen up some of the hip musculature. Okay? And now again, take our lubricant, warm it up, oh, that's cold, and bring the lubricant down. This is a therapeutic massage cream. I won't mention the brand. I'm not getting any endorsement money. So, you can choose the brand that you like. Getting the gate open. Proximal medial lymphatic of the left extremity. Good, that's open. I can come back down to the ankle and start flushing out between ankle and knee. Just let your hands drape right over the tibia. You could do specialized work here if there were some muscles that needed it, but this cleans out that lower leg anteriorly. Face the table. Infra and suprapatellar. Just a little ringing type motion. And now I'm coming back up here to the left thigh. Some effleurage. Some petrissage. Now the petrissage you can do in 3 lines. 1, 2, 3 if you like. One, medial, anterior, and lateral. And you could do some chucking or ringing. Back down. Effleurage, 1 or 2. Nerve strokes. Shake it out. Now keep your client covered. Okay? Keep them warm. The foot can be worked both from a supine and prone position. So, stabilize the foot, use your knuckles. It's one way to do it. Okay? Does it hurt? Modulate your pressure according to the needs of your client. And just like the hand, you can also work this way. You can do the dorsum. You can work between the metatarsals. Or you can work like this, seated, squatted, or on a knee. And just follow lines up. You can do individual points. You know, in foot reflexology, the brain is here, the neck is here, the sinuses are here, and your spine goes all the way down to the coccyx here. Okay. I traction the leg a little bit, just some gentle traction. That's it. We can move on to the other side. So again, I'm going to make a triangle. I'm going to fold over. Draping is very important, especially keeping your material under control, because if you don't control it, it will control you. Okay? And again, I'm going to put my lubricant on from proximal to distal. Open up the medial lymphatic channel. Notice I stabilize the limb with my other hand. And always keep 2 hands on the client, even if one is not working. Come down here, lower leg, effleurage, just hook over the anterior tibia. Very nice little shelf of bone here. Face the knee, ringing. Come and effleurage the thigh. Ringing. Leave some space between your hands. Push, pull. Push, pull. Pull, push. Some petrissage medially, anteriorly, laterally. Come back down here. Do 1 or 2 full effleurages. Nerve stroke. I shake out my hands just as a habit, just to get the energy out. Good. Now I'm going to do the foot. And again, when it comes to lubrication, remember, less is more. New student massage therapists always seem to over-lubricate their clients. So try to use the minimal amount of lubrication so that you have a good glide, and but you have some resistance. Lubrication, purpose of lubrication is just to minimize discomfort for the client. And I do a lot of my massages with little or no lubrication in certain parts of the body. And run between the metatarsals. I do this because it feels good. I doubt it has very much therapeutic value. Under the malleoli, medial and lateral malleoli. Some circles on the hip, the ankle rather, heel. I'll get it. And then spreading apart See how I'm spreading apart the musculature? Because during the days, the intrinsic muscles of the foot are compressed by footwear, shoes. And so I want to spread that out. Spread them out. And then run some lines, heel to toe. And then pick some points. And a lot of this, many people find this feels very good. Some people don't like their feet being touched, in which case I say that's fine. I'm not going to do anything to you that you don't like, and hopefully not cause you any pain. Remember our oath is do no harm. Hippocratic oath. Okay? And so we're now done with the left extremity, lower extremity. Now we come up to the right upper extremity. We're going to lubricate that up just like we did with the other arm. Stabilize the hand, effleurage. Now I'm going to pick up the arm, okay? Relax, I have the arm here. And I'm going to lubricate the upper arm. All you have to do is just trap the arm between your arm and your body. And I can work the deltoids. I can work the triceps, biceps brachii. I can do ringing. Another way of working the arm, just relax, let go, is like this. You don't have to trap the arm. You can just do this if you like. If you're more comfortable with that, or you're a female therapist and you're big busted and you're not comfortable with doing that sort of thing, then you can do this. You only, remember, you only have one hand to work with, but that's okay. Okay? So now, I'm going to come back down here. I'm going to then do my forearm, my flexor compartment. If a person has a tendinitis or a problem like lateral humeral epicondylitis, tennis elbow, you can do specific work by pronating their hand and going right into this area and frictioning it. You know, if they're not in the acute phase, subacute phase of healing. This is very important, this kind of work on the forearm for people who use their hands a lot, like massage therapists, people that type, keyboard. Okay? Pronate the hand, bring your fingers under, sweep under the fingers. 1 or 2 effleurages, stabilizing the hand with your non-working hand. A couple of nerve strokes. Now I'm going to do the hand. Okay, so there are several ways to work the hand. Okay, I'm going to do the dorsum of the hand. You can also work the hand like this. Remember, relax. Spreading, spreading. Spreading those intrinsic muscles, the muscles that begin and end in the hand, below the wrist, like the lumbricals. Then the pill rolling with the fingers. Switch hands. And the thumb. Some people do rolling, they do it side to side. In other words, this surface and this surface, medial and lateral, and then dorsal and ventral, or anterior posterior. Okay. And so this arm is done. So now we can put this arm underneath the sheet, and now we're going to ask her to turn over, and we're going to put our face cradle up into a working position. Okay, so remember, your client always must rotate towards you so that you can catch them in case they roll off the table. So please turn over this way. Come. And they may be a little sluggish because at this point, hopefully they're well sedated. I'm going to put in the bolster. When you do the bolster, reach under the fitted or bottom sheet. Okay, pick up the client's legs and put the bolster in. And no, I do not use a bolster in the supine position. It's just how I was trained, but if you want to, that's fine. That's up to you and the client. Okay, so now we made sure our draping is even all the way around. And we're going to, I like to do a little rocking. It's kind of like a Traeger work. Little rocking. And since we're in a school setting and we wear underwear, in the massage world, the best massages are given with no clothes on at all. If your draping is correct, that's not an issue. But I like to do some compressions of the gluteus maximus because the gluteus is a major stress holder. And so my hands are like this and I'm pressing down and towards me in an attempt to roll the muscle mass off the bone, off the innominate bone, off the pelvis. And I go down as far as the head of the femur. Now a lot of people have sensitivities, some very sensitive points here. Remember the sacrum, V shape, sacral base, coccyx here. And I like to find a point here that might be tender and just dwell on it to desensitize it. So my hands are like this, 8 fingers stabilizing, 2 fingers, 2 thumbs working. Is that tender at all? No, good. Okay, so now I'm going to work the posterior right leg. Again, I'm going clockwise. One nice thing about this approach is also that you end up with the back, which is kind of the bread and butter area for massage therapists because of all the stress that people hold in their body in that area. And I just move her hand out of the way a little bit. So I've got her draped. If you wanted to get a little higher, you could just tuck here, tuck, tuck. Lubrication. Bring the lubricant down. Do a few effleurages, and remember, again, open up the gate. Even though you opened it up before, medial lymphatic chain. Stabilize. Lubrication application should be sensual, and it's not something you just slap on a person. It's a stroke. It's not an official stroke, but it should be done with intent. Splitting the 2 heads of the gastrocnemius, working both the gastrocnemius and soleus muscles, the calf. Again, just follow the curves of the body. This is a wonderful muscle for petrissage. If you're new at massage and you're practicing petrissage, this is the muscle to do it on. Some chucking, ringing. Notice I always keep working, I don't stop.